So I'm feel so happy to be here. This is actually my first Asian Tobacco Harm Reduction Summit. I'm happy actually because even though with all this COVID-19 pandemic that we have, we still, and organizers still advocating these harm reduction, tobacco harm reductions, without being distracted by this COVID-19 pandemic. So we know this COVID-19 is here, the pandemic is here, and smoking doesn't stop even though COVID-19 is here. Perhaps maybe increase because of the lockdown or quarantine. My name is Asrul. I'm a professor in the University of Science Malaysia, and also a member of the Malaysian Society of Harm Reductions. So this society is a newly established society, and we advocate a lot of activity on harm reductions in Malaysia. So I understand that I'm only given 10 minutes, okay, with that specified 8 slides to discuss all these major points. So I put that and keep that in mind when I'm preparing my slides and also my talk. And I believe that I can guarantee I can meet this in time. Just briefly on the tobacco control strategy in Malaysia. So I think when I see other countries' presentation just now, I actually felt that more or less we do have a similar history of controlling tobacco in Malaysia. So we began in 2004 when I think prior to that, we always see the tobacco advertisement, a Lucky Strike advertisement, a Marlboro advertisement at any sports events in Malaysia. But in beginning in 2004, there is a control of tobacco regulations that ban advertising, sponsorships, and also free tobacco. 2005, we actually rectify the WHO framework for control of tobacco. And from then, Malaysia became the party to this WHO and quite consistently pursue all this agenda of this WHO framework. So in 2007, they introduced the excise tax duty where it increased by 25%. And from then on, there is some regulations amended. 2009, they have this. They noted that even though increase of tax duty, but there are some tobacco company that still have promotions or perhaps selling it in a loose pack. So which is why in 2009 and 2010, there is amendment to this how tobacco is being sold in Malaysia, where they introduce a minimum price for cigarettes, and there shouldn't be a promotion price, and also no kiddie pack. In 2011, there is a serious movement towards a smoke-free legislation. So a number of places in Malaysia has been gazetted as a smoke-free, especially in air-conditioned place. So I think almost all these public institutions, organizations, and private institutions have actually been gazetted as a smoke-free place, except for a few, for example, like a pub, bar, karaoke place. So those are not under the same, those are not legislated as the smoke-free environment, smoke-free place. So a few states in Malaysia, we have 14 states. So a few states have initiated a smoke-free initiative. For example, like Malacca, Penang, who actually established themselves and gazetted a smoke-free state. It means that even in public place, people shouldn't smoke. So if caught for smoking, so there is a fine of up to 20,000 or 2 years of imprisonment. So from then on, there are some amendments to actually include more and more states who to be smoke-free. Okay, so that's a brief history of the control strategy in Malaysia. So how successful are we then? So the control strategy in Malaysia is always based on controlling the number of people who smoke. Perhaps what we want to see is there should be a reductions in the number of smokers in Malaysia. And that's what we actually see in Malaysia, okay? From year 2000, so there's about a third of Malaysian, 29% are smokers. And this has reduced to about 21% in 2020, which is actually quite a marked reduction, about 10% of reductions in terms of prevalence of smokers. But we all know that reducing smokers is not the end point of the game. The reason why we want to reduce smokers is not only because that we don't want people to smoke, but most importantly is because we realize the health impact of smoking. So we want people to stop smoking because we want to make sure that there is an improvement in health. There are a number of diseases where the major risk factors are smokers. So we want people to stop smoking so that then we can reduce this major illness. So the end game that we want is actually not only that people reduce in smoking, but we also want the disease as a whole to be controlled and reduced as well. So, but what we see, okay, a number of diseases, okay, which is related to smoking, okay, where smoking is one of the major risk factors, increasing. Okay, so these are the top 5 principal cause of death in Malaysia. So we see the trend for the past 5 years from 2015: ischemic heart disease, cerebrovascular disease, malignant neoplasm of trachea, bronchus, and lung. So these 3, so the major risk factors are smoking. And then their numbers are increasing over the years, over the past 5 years, okay, which actually shows that perhaps we managed to control the number of people who smoke, okay, but we are perhaps not that successful in controlling the consequence or the disease related to smoking. So, but we also understood that there can be many other factors that contribute to this disease. But it also shows that to us that perhaps the strategy that we are pursuing might not give us enough power to achieve our end game. There are a number of challenges to the tobacco control in Malaysia. So even though it was nice on paper that we have these smoke-free legislations, that we have these advocacy programs, stop smoking, say no to smoke every year. And we also have about more than 300 quit smoking clinics throughout the countries, okay? But we noted that we are still unable to control either reducing the number of people who smoke to 0 or the total impact of smoking. People still smoke, so most probably and most likely it's the poor enforcement of failure. So the law is there, but it usually good enough when it was launched. Okay? So after a few months it was launched, the enforcement no longer loiter around the retails, so people resume to smoke. Even some enforcement agency were caught to be smoking as well in this place. There is also this problem of controlling the availability of cigarettes, especially to teenagers. So even though they no longer sell it as a kiddie pack in retail, but there are always a problem with loose pack being sold in unofficial outlet. And also the availability of cheap and smuggled cigarettes. Because we have quite a long border and with limited enforcement agencies to enforce the border control. So we do have a problem having these cheap smuggled cigarettes, which actually can be sold much cheaper and without much sales regulation as what we had for official cigarettes in Malaysia. So, and even though we have this quit smoking clinic, okay, which in principle, they use counseling and also NRT, the nicotine replacement therapy, but the success rate is as low as 17.3% to 51.3%, depending on the clinic. But this is worrying as well. Okay, some of them are actually resume to smoke, and which actually give a challenge to this quit smoking clinic and also tobacco control in general in Malaysia. So, so what we have in Malaysia now, I think I heard from Indonesia as well. The focus is always on the non-smoker, smoker, trying to reduce people who didn't smoke to become smoker, which is good, and trying to make sure that people who smoke to also quit and become non-smoker. Okay, and they realize that there is a link between smoker and smoking complications, but okay. But the link is not realized in terms of policy, in terms of the way that the authority look into harm reduction programs that actually do not seek to actually compete with tobacco control, but actually looking at the different path of reducing smoking complications, which is the end game in these issues, and try to make sure that people actually, I mean, those who are unable to completely stop smoking, to actually be able to reduce their complications by having a non-combustible cigarette alternative. The general consensus, the general feeling that we had from the public authority in Malaysia is that they're totally against these tobacco harm reductions for many reasons. I think many years ago, it was because of religious arguments, and they actually banned all outlets from selling these. And then it's slowly coming up again, but then there are some talk about trying to restrict that it being sold only in a pharmacy, but still just talk, and people are still being nervous of what new regulations are going to be introduced by the country for these non-combustible cigarettes, which actually provide a good alternative for tobacco harm reductions. So with that, I think I close to the time now. I thank you for the opportunity to Prof. Sharifa for chairing, and thank you very much. Terima kasih.